Have you been diagnosed recently with a medical condition and you're worrying about the side effects of the medication you've been prescribed and you want to know how to minimize these side effects? Well, then stay tuned. I might have some tips for you. My name is Dr. Felix Effa. I'm a neuropharmacologist and a toxicologist. This information I'm going to give you is for educational purposes. Do not take any actions based on this information. Make sure you consult your general practitioner or your primary care physician. Now, as a toxicologist, I get asked this question a lot. How do I minimize the side effects of my medication? Now, of course, if you've been diagnosed and you're being prescribed a medication, there is one important factor that you need to consider, the dosage of that medication, because it is not the substance that makes the toxin, it is the dose. If you're on a high amount of a drug, it means that the side effects are going to be higher as well. So you need to find a way to minimize that by, number one, reducing your stress levels. Now, stress is a bad combination with any medication when you're going through any medical condition. So as soon as you try to minimize your stress levels and your cortisol levels in your blood, that is the first step. You reduce the side effects of that medication, because stress working together with your medication and the side effects will increase and cause drug-induced organ damage. And the organs that I am looking at more critically are your kidneys, because they are the most functional, and most of the drugs that we take, not most, but some of them are being metabolized by the kidneys, whilst the majority is metabolized by the liver. So the kidneys and the liver are what I'm actually critically concerned about. Of course, you need to also make sure that you're taking in a good amount of water daily. Now, stay hydrated. I know it sounds like a cliche, stay hydrated, but it's a very important factor, because when you are hydrated at a good level, it basically reduces the amount of work that your kidneys have to do to excrete, I can't even speak any English anymore, to excrete the waste product. So it dilutes the amount of waste that is in your bloodstream for your kidneys to do less of the work, because you are hydrated enough, right? Now, water does a lot of good things to our body, because I don't want to go into too much details, but yes, hydrate yourself a lot. And the number 3 is sleep. Now, there is literature to show that people that have their circadian rhythm, now circadian is your sleep-wake patterns, right? People that have this pattern ruined are more likely to develop a lot of medical conditions too. So once you actually try to reverse your sleep patterns, you sleep at the right time, you have your 8 hours sleep at night. It is not even about the amount of sleep you have, it's about the quality of the sleep. So if you're sleeping 6 to 8 hours, but you have a quality sleep, right, it is really also going to minimize the amount of side effects your medication is going to have on your organs, on your body. This is because during your sleep, that is where your body tries to excrete all the toxins, all the bad stuff from your body. And so if you give it time enough to do that, then it is refreshing every morning for you to keep going for a long time. The 4th advice I will give anyone as a toxicologist to minimize the side effects of any medication is exercise. See, when you're exercising, you're basically giving the chance to the largest organ of your body, which is your skin, to open up. So the pores in your skin are going to open up, allowing not your kidneys to excrete the waste products that the drug has actually produced, but it allows your skin to excrete those toxins from your body through sweat. So when you exercise aerobically and you're sweating, you excrete some of these toxicants that the drug has induced inside your body. Now, of course, you need to also, number 6, you need to make sure that you're eating healthy. Now, when you have a balanced diet rich of antioxidants, now, when this drug is being metabolized either by your kidneys or by your liver, they will produce what we call reactive oxygen species or reactive nitrogen species or whatever the toxicant may be, your antioxidants, which are in your blueberries, your strawberries, and all these nice vegetables and leafy greens, what they do is they scavenge. Scavenging means they sweep off all these toxicants from your bloodstream, right? By binding to them. So they go and it's like they're searching for these harmful substances in your bloodstream and they bind to it so that it prevents their harmful effect on your body. So eating healthy, having a balanced diet is one important factor to reduce the side effects of any medication that you're taking as well. Now, number 7, of course, you have to practice mindfulness. You need to make sure that you're going for, you're paying attention, you're breathing in. Practicing mindfulness is very important. It's good for your mind, it's good for your body, it's good for your soul. And all this will help you live a long life, even though you're diagnosed with a medical condition and you're being medicated. I hope this information really helps you. And if you liked this video and you want to see more of these, please consider subscribing to the channel because I'm going to be coming with some of these videos so that you can get notification whenever I post videos like these. Thank you very much for watching. Stay tuned for